We frequently talk about the crisis in the NHS, the 800,000 people on waiting lists, the corridor care because our hospitals are overflowing, the queue at the front door of A&E, sometimes people waiting for over 12 hours, the highest level of delayed discharge, I think since devolution, and of course the 8 a.m. rush to get an appointment to see your GP, who I know in some cases are having to take clinics in porta cabins. But you know, we forget the emotional toll that that takes on the workforce. So no doctor, no dentist should go home feeling that they've let their patients down because the system isn't working for them. But this is happening all too often, and it is pushing many to breaking point. We need to ensure that staff are well resourced, that they have the tools that they need to deliver for patients. They've been stamping out abuse in the job, and it means fixing primary care so GPs and dentists can properly support their communities. But we genuinely don't pay enough attention to retention. And let's try and keep the people we've already got. Let's stop them from burning out, and let's truly value them. Scottish Government needs to prioritise the well-being of staff and put them at the very heart of any long-term workforce plan.
And we really do need to start concerted action as soon as we can. I think there is cross-party, cross-professional will there to do that if we can keep the sustained level of attention, which we think is in everybody's interest, to not simply make people feel better in their job day in, day out, but actually be able to make the contribution they make into the well-being of the entire nation that much more effectively. There's a case for a real task force, short life, set to produce recommendations by the summer, to which we would hope government can respond.
Similarly, I absolutely appreciate and understand the pressures that there are at the moment. I would be the first to say so. I see it day and daily when I am out and about. I was in Glasgow Royal Infirmary today, seeing the work that's been done on embedding the frailty services that we want to see next to all accident emergency services, so that we can see a better position in acute services. I see it in conversations as well as visits that I have to colleagues that are here from the BMA, from the Royal Colleges, and seeing you in situ as well as in discussions. I understand it. I also understand it having sat on the Nursing Midwifery Task Force. And so from the whole service perspective, I hear and understand what you are saying. I think I'm more than happy to reflect upon the ask that's been made there in terms of a committee or a discussion between now and some.